How's your skin? It feels pretty soft. Any issues with your skin in the past? No? Okay. I just need you to follow the light. Good. Just keep your eyes on the light. Good. Hot or cold? Good. And hot or cold? Or cold? Good. Sorry, I am just getting in for the day. How's your day been? Good, that's good. I don't need these right now, but I might need them a little bit later. When I'm sitting, I can usually see it's just far away. It can be a little bit harder for me, but we're going to be finding out more about you. So, welcome to the Cranial Nerve Clinic. I'm really happy that you could come in today. I know we were playing a little bit of phone tag there. So, I'll be your nurse, and it's really great to meet you. So, basically, we're just going to start. I'm just going to get you checked in here, and just make sure we have all the paperwork done, and then we can get started on everything. Won't be too long, I promise. Let me just get a pen here. Do you like this one? We do sometimes have some youngsters come in, so, you know, sometimes it's fun to have something a little fun at work. Okay, so, let me just see. Here we have your name. Okay, is that how you spell it? Okay, just making sure. Okay, and your date of birth? And your date of birth. Oh, cool. That's actually my dog's birthday as well. Yeah. Okay. And yeah, I mean, you guys could have a joint birthday or something. Okay. So, do you have any vision issues that are known to you? Okay. Okay. And any known health issues? Okay. Okay. Have you ever been in like a car accident or anything like that? Okay. Any concussions? Okay. How's your skin? It feels pretty soft. Any issues with your skin in the past? No? Okay. Any major surgeries in the past 5 years? Okay. Any major surgeries in general? Okay. What happened? Okay. How are you? How did you heal? Were you okay? Okay. Good. That makes me happy to hear. Okay. Let's just take a look here. Okay. I think that's it. Just a quick little check-in. Are you scared of anything? Do you have any fears? We're not going to be doing any needles today, so don't worry about that. But we do have some little pokey and prickly things that we're just going to be lightly poking you, almost just kind of like this. I'd be like, you just can't tell me if it's like soft or sharp, and do some hearing stuff. and some eye stuff and mouth stuff. And I'm gonna be a little bit up close and personal with you, and I hope you're okay with that, because I will be having to get a little bit close. Like, do you think you'll be okay if I'm like this close to you? Does that make you uncomfortable? Okay, well, what if I'm like this close? Does that make you uncomfortable at all? Okay, good. It's totally okay if you are. You can be honest with me. It's just sometimes when I'm working, I just get caught up in the moment, you know? And yeah, but as long as you're cool with that. I mean, sometimes I do get told that I have no boundaries, and sometimes I'm like working all up in people's faces like this, and I'm just all over them. But I will try to be more reserved. I have been working on it, because I did get written up last week for being a little bit too close with some of the patients, but I'm working on it. I mean, they try to say that I don't have any boundaries, but I do have some boundaries. It's just, I'm really into my job, that's all. Do you know what I mean? Like, I just like to make the patient feel like comfortable and relaxed, and I know it can be hard to come in here, especially to like a medical office, and I just want you to feel like, you know, they were just hanging out, and it's okay, and you don't have to be worried. But I will try not to get too close. Okay, let me just take a look at this here. Okay, this is done. This is done. This is good. Okay, perfect. Okay, all I'm gonna need is just your signature here, so we can get started. So you can just sign that the information written here is correct. Here you go. And then I just need you to sign this waiver right here, just saying that you know that this is a cranial nerve exam. I kind of went over more or less everything that's going to be happening. Obviously, nothing invasive. Okay, great. And the last part, I need you to sign that I did tell you that sometimes I do struggle with boundaries, and sometimes I get close, and you're okay with that. Okay. Just sign it there. Great. Okay, perfect. Great. Okay, so we can get started now. The boring part's out of the way. Let me just put your paperwork over here, and we can get started. So, the first test I like to do, it's not even that bad, so don't worry. This is just sort of an eye test for me, so the first thing I'm going to do is I just want to check your eyes. So I'm just going to kind of get up close and a little personal, and I'm just going to look at each of your eyes and just make sure everything visually is looking good, okay? So your only job is to just sit really still and just kind of let me do my thing, okay? Okay. So just stay really still, okay? Eyelashes all good. Overall, the whiteness of your eye looks good. Let me see this one. Okay, yeah. The corner in there looks good. And the whites look good. You have really nice eyes, by the way. No, I really like the color. Yeah, you have really nice eyes. Wow. Really nice eyelashes too, actually. Really, really nice. They really suit you. Yeah, I like your eyebrows too. Okay. Visually, sorry, that was a little. Visually, everything looks really good. But I won't really know until I run another test. So, this part uses this pen, okay? But it's also a light, so I just don't want to jump scare you, but it's also a light. So basically what's going to happen is I just want you to use your eyes and just follow the light as I move it, okay? There's going to be points where I'm going to hold your face. I might get a little bit closer, I might get a little bit further away, but your main job is just to focus on the light and nothing else. Okay? Do you think you can do it? Don't worry, it's not like a pass or fail type of thing. It's to get a scale of where we're at with your, it's not so much about your eyes, it's more just seeing the connectivity between your eye movement and your brain, which is really the main focus of this exam. Okay? Okay. So we'll start really easy. I'm just gonna start here. Ready? Okay. I just need you to follow the light. Good. Just keep your eyes on the light. Good. Keep your eyes on the light. You're doing really great. Go a little higher. Just keep your eye on the light. You're doing a really good job. Eye on the light. Good. Eyes on the light. Okay. Now I'm just gonna get up kind of close to this eye, and I'm just gonna turn it off, and then I just want to see your pupil react. So, ready? Okay. Good. Actually, really great. Just turn this one off, and I'm just gonna come on the other side here, and pupil. Good, really good. No worries there at all. Okay, good. And I'm just gonna come a little closer here, and I just need you to do the same thing. You're gonna follow the light, okay? Follow. Keep your eye on the light. Keep your eye on the light. I know it's a little strange. And around. Good job. You did really great with that. I have no worries for that part of the exam for you at all. Everything was good. Pupil reaction was good. And following was overall really good. There was one little point where it seemed like you got a little bit distracted, but overall, I would say you got 95%. So the connection between your eye and your brain seems pretty good to me. So for the next part of the exam, this part's going to feel a little bit more invasive, but don't worry, I'm going to be extra careful with you, so don't worry. But basically, what's going to happen is I'm going to poke you, poke, but not with my finger, but with an object, and you're going to tell me if it feels sharp, or soft, or sharp. But it's not going to be very sharp, so don't worry. It's not going to like hurt or anything. You'll just be able to tell. It's like something like this, like a pencil top. So let me just give you a little. Okay. The only difference is you're just not going to see which thing I am touching you but you should be able to tell if everything in your cranial nerve is working properly. Then you should easily be able to tell if what you're feeling is sharp or soft. Okay? It seems basic enough, but this is how we run the test, okay? Are you ready? I have to get up really close for this. Some of the doctors don't, but I personally like to. Is that okay? Okay. Are you ready? Okay, can you tell me what it feels like? Okay. So. What did that feel? Sharp, okay. What did that feel like? Soft, good, okay. What did that feel like? Sharp, good, okay. And shoo, shoo. What did that feel like? Soft, good, okay. Now this is going to get a little bit trickier. I'm not going to show you. Instead, I'm just going to do it on the sides of you, and I might swap them so you're not going to know. But basically, I don't want you to see, okay? So you just tell me what it feels like. If it feels sharp or feels soft. Okay, are you ready? Okay. Okay. Good. Okay. Good. Soft. Good. Good. That one wasn't too hard, was it? That one wasn't too bad, was it? Okay, now this one is going to be a little bit different, but same kind of concept. I need you to give me your hand, okay? Just give me your hand. I'm just going to warm it up in mine. Just going to warm your hand up. Does that feel nice? Okay, now I'm going to prick your finger just with this little thing, and you tell me when you feel it, okay? You ready? So, prick. What finger did you feel that on? Okay, good. Okay, and poke. Which finger did you feel that on? Okay, and poke. And poke. Which finger did you feel that on? Which finger did you feel that on? Good. Okay, let me just put my glasses on here for a second. Okay. Give me your other hand here. I'm just gonna warm it up. Warm it up, warm it up, warm it up. Okay, now tell me which finger you feel the prick on, okay? Are you ready? And poke. Good. Good. Poke. No, no. Try again. Which finger? Poke. Good. And poke. Good. Poke. Good job. Which one's it gonna be? Poke. Good. Poke. Good. And one more. Poke. Good job. That was really great. You only got one bit mixed up, but I think that was just more of a misspeak. So your brain to your senses on your skin seem to be doing pretty good, which is great. That's great, you know. People take that for granted. That's something, you know, some people don't have or isn't working very well. So that's great. Just give me one moment here. Just get this set up on the computer for reference. You're doing really great, by the way. Are you feeling okay? Okay, good. So the next part of our exam is going to be, I need you to tell me if the sensory item I put on you is hot or cold. And again, it might sound simple, but this one is something even just regular people sometimes have trouble with. So don't get too in your head if you do get a few wrong this time, because it's completely normal, and just do your best, okay? Okay, let me just get our items here. Okay, so we have this little guy here, which looks like just a regular type of tool, but it's very sophisticated. Basically, this one side is cool, and then the other side feels warm. So what I'm going to do is I'm just going to lightly, and I know I get all up in your face, but I'm just going to lightly touch and press different sides, and you're going to tell me whether it feels hot or cold, or hot or cold, okay? Pretty simple, but I know it can be a little bit overwhelming. Don't worry if you get some wrong, okay? It'll be okay. I'm just gonna move some stuff here over. I'm just gonna play a little closer to me, okay? Are you comfortable like this? Okay, then I don't have to wear my glasses, which is nice for me. I know. On, off. I can never make my mind up on anything. So you're comfortable like that? Okay, are you ready? Okay. We're just gonna go press, and is it hot or cold? Okay, good. And then press. Good. And press. Good. And press. Good. And press. Good. And press. Hot or cold? Good. Okay. Hot or cold? Good. And hot or cold? Good. And hot or cold? Good. Okay. And hot or cold? Good. Hot or cold? Great, really nice hair, wow. I know it's kind of random, I'm just like up here right now. Really nice hair. Okay, I'm sorry, I got distracted. Okay. Hot or cold? Good, and hot or cold? Okay, hot or cold? Hot or cold? Good. Hot, cold. Good. And I'll do a couple more. Hot or cold? Good job. Hot or cold? Good. And one more. Hot or cold? Good job. You did really great with that. Usually people struggle with that one, but you did tremendous. I'm really proud of you. Good job. Here, let me give you a hug. You're like one of the only people that's ever been here that's gotten them all right. Sorry, the banter thing. That is not professional at all. Please don't tell my boss. I'm just really excited for you. That's so exciting. Good job. Your sensories for hot and cold are off the charts. A lot of people say that, especially with water, it kind of feels the same if something's really hot for a lot of people or really cold. It's hard for people to tell the difference. I know it doesn't seem like it, but it's true. Yeah, you did really great. Good job. Holy moly. Okay. Great. Okay, so the next part of this test is kind of, I guess, more conventional, depending on, have you ever had one of these done, by the way? I guess I should ask you that. No? Oh, you have? When you were a kid? Do you like me better than them? What, as like an examiner? Like, do you like it better? Or worse? You like it better? Really? You're just saying that. You're totally just saying that. Whatever. Anyway, okay. So, it is interesting. You do look really familiar, actually. Do we know each other? No way, really? I practiced on you? What, when I was like in my practicum when I was interning? Where? I was there. Wow, I actually thought you looked familiar. I can't believe that. That's so funny. What are the chances that we run into each other again? Yeah, it's all coming back to me. I kind of thought when I saw you, you looked familiar, but I just couldn't place it. That's so funny. Did you know? You didn't? I don't know either. Did I look familiar? Yeah, I'm not like in my scrubs, I guess, now. I do love this clinic, so they do let us dress a little bit more casual, but I do get in trouble before for being a little bit, they said too casual, but whatever that means. Anyway, it's really good to see you again. I'm glad that we could do this again. I had bad boundaries last time too. Yeah, listen, I used to be worse, okay? I'm working on it, okay? Listen, we're gonna run out of time. We better finish the last part of the exam. And just make sure that I can get you out of here. I'm gonna have to keep you here all night. Okay. So, the last part of the exam. The last part of the exam is going to be using a little bit of a funny looking thing, but it's really great for cranial nerve examination and just making sure everything is working the way it should be. I'm going to just touch you basically like this on different parts of your mouth. Boop, 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 and different teeth. I know it's kind of weird, but I'll sanitize it, don't worry. But I'm just kind of going like tapping on different parts of your mouth, just making sure that everything is responding to how it should be and all the nerves in your mouth are working great. And you don't have to tell me the exact tooth that you feel me tapping on, just if you feel it on the left or the right, because most people can't really tell exactly what tooth it is. But let me sanitize this for you real quick. I'm just gonna spray it down here. Let me grab my spray. And I'm just gonna wipe it. Okay. Are you ready? Don't be nervous. Don't be nervous. I know this is the weirdest part of the exam. That's kind of why I like to save it for last, but at least you get the last part done and then you're free to go. Okay? Are you ready? Don't be nervous, Mike. It's okay. Don't be nervous. It's okay. Okay, you ready? So, I'm just gonna go boop, boop, boop. Do you feel that on your lips? Good. And I'm just gonna trace your lip. Trace, 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 and around, and around, and around, and around, and the other way around, and around, and around, and around. Good, okay. That was good. Did that feel good? Was there any like numb points or anything? Okay, good. Okay, now I'm just gonna need you to show me your teeth. Okay, I'm just gonna start tapping, okay? Don't worry. Left or right? Okay, good. And left or right? Good. Left or right? Good. I know it's a little weird. Good. Okay. Good job. Left or right? Good. 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 Good job. And open up a little bit wider for me. Good. Good. Okay. And left or right? Good. Do you want to try one where you can kind of guess which tooth I'm tapping? It's hard. Ready? Close. Close is the one beside. That was close to that. This one's hard. I don't want to tap too hard so it hurts you, but I think if I tapped harder, it makes it a little easier. Yeah, there you go. Good. Well, that was great. I expected you to do good. I mean, you can kind of tell by about halfway through the exam if there's going to be some sort of issues with the cranial nerve or if things are kind of just chugging along the way they need to, but you did absolutely great. A few little things that can be wrong don't necessarily point to an issue with your cranial nerve. It's actually just human, and if there was an actual issue with your cranial nerve, it would be there would be like consistent errors in the test. So you overall did great. I am really sorry about what happened, and I'm happy for you that everything is working the way it needs to. And if you don't mind, I would like to see you again in about 3 months to double check again, just to make sure nothing's progressing, nothing was missed. And then after that, if that goes well, I don't think you'll need to really come back. I'll be sad though, because I want to see you again. Oh my god, do not tell my boss that I said that. I'm gonna get in big trouble. Don't tell. Promise. Do you promise? Okay. No one's around. Is it okay if I give you a hug before you go? Okay, come here. Thank you so much for letting me practice on you again, except this time I'm actually qualified. I am really sorry that I got a little bit too close, but you did great. I'm really happy for you, and I'm really happy to see you again, actually. Yeah. Okay, well, do you want me to pencil you in for 3 months, or do you want to just like call and book it when you're ready? Okay. Alright, well, thank you so much for coming in, and I hope you have a really good rest of your day, and I hope everything goes well. Don't hesitate to give me a call if you notice anything weird, or you're feeling dizzy, or anything like that. Anything goes wrong, seriously, if you're feeling dizzy, anything new comes up, please call me. Otherwise, I'll see you in 3 months, and I hope you have a really good rest of your day. Alright, bye.